Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me to discuss the reallocation of funds to the healthcare system and telehealth and how people with substance abuse disorders are faring during COVID-19 is Beau Mann. He's the CEO of SoberGrid. Beau, welcome to Trade Talks. It's great to have you with us.
Thank you for having me.
All right, Beau, with cuts expected to law enforcement budgets, do you think any of those funds could be allocated to the healthcare system and telehealth services? And what would that mean if it happens?
Absolutely. You're seeing a number of cities and other government agencies saying that they'll allocate funds to healthcare and social services. Boston is one example of that, where they're going to allocate 20% of the police overtime budget to health and social services. I think with this, you'll see a lot of that funding going to telehealth services, specifically for substance use disorders. At our company, we just signed a contract for to serve all minorities with substance use disorders in the state of Ohio this last week.
And Beau, during the pandemic, apps for people with substance abuse disorders were significantly relied upon. The same trend has been seen with mental health. Was this trend accelerated as a result of COVID-19 or something that you have been seeing for a while?
So you've seen the telehealth market have a 25% growth over the last 5 years. I think now we're projecting it to be about a 30% year-over-year growth. I think with COVID-19, that's going to be accelerated. Also with what's going on in the climate and the political climate, you'll see that accelerated as well.
Tell us more about SoberGrid. You mentioned the contract with Ohio, which clearly has substance abuse issues that was well documented even prior to COVID-19. So what does SoberGrid offer consumers of the product?
So SoberGrid is the largest mobile app for people with substance use disorders and mental health issues in the world. We're primarily focused in the United States, but we are adopted in over 170 countries. We started providing services, telehealth services, in addition to being a community of people to gather and provide mutual peer support. Once we developed an artificial intelligence that could predict if someone was approaching a higher risk of relapse, we acquired a telehealth service that has state-certified addiction recovery and mental health coaches. We did a lot of contracting with different communities in Ohio, and we recently expanded nationally. Now we're serving with contracts the state of Louisiana and Connecticut, Indiana. So we're expanding nationally. So we're there to provide support, and we're also going to be rolling out telemedicine where people can have see addiction doctors as well as see psychiatrists.
Do you think telehealth and apps allow those struggling with substance abuse a more democratized approach to therapy, maybe a comfort level in your own home, where it's easier than having to schedule around work and doctor's office visitation times?
Absolutely, and it's great in that it reduces so many barriers. If you have children, you have a difficult time, you don't have childcare, or if you live in a rural area and they may not have addiction MDs, or they may not have addiction and mental health recovery coaches in even all cities, let alone all rural areas. So it really democratizes it, just as you were saying, opens up the accessibility, and it provides 24/7 access. And because it can be done at such a large scale, the cost is oftentimes lower. So the cost factor is actually lower for people as well. So it really opens it up in so many different levels.
All right, Beau, great to have you with us. Thanks for all the great work that you're doing.
Thank you so much.
And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.